Hello everyone, and welcome to week 3 and lecture 3 for VSR 200. Before we get started in our lecture today, I just want to go over the assignment so everyone is understanding what is expected. The VSR 200 assignment pertains to surgery. You are to choose one of the 4 following options. This assignment is due by end of day February 17th, 2023. The first option is to research the items within a common surgical bag. You can seek out additional Seneca resources to help you with determining what instruments are in a spay pack or a neuter pack. You're to present these items in a list and state what their intended uses are. The second option is to choose a patient surgery and explain the patient preparation involved, clipping borders, estimated endotracheal tube size, a circuit used, and post-operative considerations. You can use a Seneca animal and refer to their chart for weighting and etc. The third option is to explain the process of a chosen surgery and what is involved. What is an ovariohysterectomy or what is a laparotomy? Explain and image where the incision will be and what process occurs during the surgery. Option 4 is to create a go-home instruction pamphlet for a client whose pet has recently had surgery, say a spay, a neuter, or a lump removal. Ensure to explain the procedure and state any post-surgical restrictions. You are to submit your assignment via Blackboard link, and a grading rubric will be used for assessment. I will just show you some examples of what we are expecting. This is an example of a post-operative go-home instruction for a client at a small animal clinic. So their dog has undergone a spay surgery and information is provided about the spay, what to expect post-operatively, both with anesthesia and surgery, and then any wound care or possible complications. This next example represents the common surgical instruments for an ovariohysterectomy. So there's visual representation of the instruments used in a spay pack, as well as a brief explanation of those instruments. So something like this would be very suitable for your assignment.
This week's lecture pertains to sterilization of instruments and supplies. Sterilization refers to the destruction of all microorganisms, bacteria, viruses, and spores. After reviewing this lesson, you will be able to give examples and methods for disinfection and sterilization of surgical instruments and supplies. You will be able to explain the procedure and importance of surgical instrument maintenance and sterilization. General considerations for care and maintenance of surgical instruments and supplies include rinsing instruments with cool water as soon as possible after surgery. Using distilled or deionized water is ideal, as there are minerals in tap water that can stain and discolor your instruments. It's important to disassemble instruments with multiple components. Also, cleaning and sterilizing delicate instruments separately will maintain the integrity of these delicate instruments. We always want to clean all surgical supplies and equipment that may come in contact with the patient, using bacteriostatic and bactericidal preparations to clean the supplies is imperative between patients. Ensure you remove scalpel blades and handles and use extra caution when cleaning sharp instruments. Instrument cleaning. After surgical procedures, instrument must be inspected and lubricated prior to drying thoroughly and rewrapping. Enzymatic preparations will denature blood or fluid proteins. These can then be scrubbed visually clean. Using an ultrasonic instrument cleaner is ideal to remove microscopic debris trapped within the box lock and the serrated parts of instruments. Once the instruments are thoroughly cleaned, the lubricant or instrument milk can be used as a soak or an application to the hinges and the box lock. This helps maintain the instruments. Most instrument lubricants come in a spray bottle, so application is rather easy. Instrument milks come in a concentrated formula, and a dilution factor is often used. The instruments are placed in a basket and then into the surgery milk so they can soak. After the soaking period, they can come out of the instrument milk and be left out to dry prior to an inspection before re-autoclaving or sterilizing. Once a surgical procedure is complete, you can collect the instruments from the surgery suite and wash them in a sink full of bactericidal or bacteriostatic dilution with water. This will help remove any of the tissue debris or blood proteins left on the instruments. Once your instruments are visibly clean, it's important to keep your ratchets and box locks open prior to putting them in the ultrasonic machine. It's important to always not overstack your ultrasonic machine full of instruments, as this can be damaging to delicate parts. It's important to always not leave your instruments in the ultrasonic for longer than one cleaning cycle, as it could lead to rusting of the box lock and ratchets. The ultrasonic machine will also have to undergo maintenance and cleaning, as the debris from the instruments tends to settle towards the bottom of the ultrasonic machine. Usually they're used for a period of time, and then the solution is discarded and replaced.
Okay, so we're going to talk about the ultrasonic cleaner. So before you use the ultrasonic cleaner, you have to take out the tray. Once you take out the tray, you'll be able to see the fill line. So you want to zoom in over here. The operating level, that is the level that you want your solution filled up to. So operating level, this is too low and it's pretty dirty too, so we would change it. But if it looks clean, and you just need to fill it up to the operating level. To fill it up, you need 4 liters of water and 10 milliliters of the design solution. Okay, so 10 milliliters of this in 4 liters of water. Pour it into your tank. Once it's filled up to the operating level, you're going to put your empty tray back into the ultrasonic cleaner. Plug it in. Put the lid on. And then you'll run a degassing cycle. The degassing cycle, you're going to run it for 5 minutes. So you turn it to the halfway between the 0 and 10. So that's 5 minutes right there. So you'll put it on to 5 minutes. I'm not going to do it now because it's kind of loud and it makes a noise that kind of sounds like shaking. That is the degassing cycle to remove any dissolved gases in this fluid. Those gases are going to obstruct the waves for the actual cleaning action of this machine. So once it's degassed, you're going to take the lid off, take your tray out again, and then you're going to lay your instruments in the tray. So you want to open your instruments. We don't want the ratchets closed. Open all your instruments. Even scissors, if you're opening the scissors, just be aware that scissors are open. The only thing you do not ever open is your towel clamp. So the backhouse towel clamps are always closed. Once you have loaded your tray, you're going to put it back in the ultrasonic cleaner. Put your lid on, and then you run it for 10 minutes.
The next step in re-sterilizing your surgical instruments can include or involve the autoclave. An autoclave is a device that uses heat and steam under pressure to denature microorganisms, so nothing is communicable between patients. There are 4 principles to autoclaving: steam, pressure, temperature, and time. Different temperatures and durations of time are used for specific wrapped or unwrapped instruments, or whether they're not wrapped at all, in a tray, or in a pouch. Most clinics have a standard operating procedure for determining the duration of time and how instruments are packaged to be re-autoclaved. You can have wrapped packs or pouches in the autoclave, usually not at the same time, as these differ for time and temperature. There are reference guides to the duration of time and temperature for wrapped and unwrapped instruments. A standard sterilization method for surgical packs is 250 degrees Fahrenheit or 121 degrees Celsius for a time of 13 to 15 minutes at a 15 pounds per square inch pressure. This tends to be a standard minimum exposure time. Some clinics prefer an additional amount of time to ensure sterility. You can also flash sterilize instruments should you need them in urgency or should they be contaminated prior to surgery. You would put them into the autoclave on a fenestrated metal tray or a tray with holes in it. You would use extra caution when removing this tray after the sterilization process. But the settings on the autoclave would change to a greater temperature of 270 degrees Fahrenheit or 132 degrees Celsius for 3 to 4 minutes at 30 pounds per square inch of pressure. This is a picture of a standard autoclave. There's a door handle with a locking mechanism. This ensures that when there's pressure within the autoclave that the door remains closed. There is often a safety feature that does not allow you to open the door when the autoclave is under pressure. There are function dials towards the bottom, a heat light indicating that it's hot, a dry light indicating that the moisture has dissipated. There is a power indicator light, a master power switch. The reservoir cover at the top covers the port where water can be added. We always have to make sure that we're using deionized or demineralized water, as that can accumulate within the machine and cause it to fail. There are pressure and temperature gauges. A timer can be set for whichever type of sterilization method you need or whatever packs you have inside, and a temperature dial to choose for packs that are wrapped or unwrapped. Looking inside of the autoclave, there tends to be a basket or a rack inside that holds the tray. Notice the fenestrations on the tray, the holes at the bottom. These are the trays that are ideal for flashing instruments that are not in a pack. There's a drain valve to remove the water or replace the water as necessary. The gasket on the door must be inspected for its integrity, as these can dry out and then you will lose your seal of your autoclave. So autoclave maintenance and inspection is imperative to our instrument sterilization process. When we are loading our packs into the autoclave, it's important to always make sure that the air can circulate around your packs. This will ensure that each pack within the autoclave is sterilized when the cycle is completed. If your autoclave has too many packs within it, this will provide an inadequate amount of sterilization pressure towards the center of those packs. The PSI for sterilizing has been ensured for a single thickness pack. So if you can imagine stuffing 6 surgery packs into this autoclave, it will likely cause compromise to your patient and the center of your packs will not be sterilized. We also have to make sure that when we're loading our autoclave with our surgery packs, that they do not touch the edges of the autoclave. The edges of the autoclave within the barrel get very, very hot, and you could risk burning your surgery packs. This is how we operate our manual autoclave here at Seneca. This video has no voiceover, so I will talk you through it. This is one of our autoclaves at Seneca. This is Peggy. Peggy's looking inside the water reservoir to see if there's an adequate amount of water. She's determined that there is not an adequate amount of water, so she's adding some distilled water to this water port. Once the water is appropriately filled, you can place the reservoir cover back on. We're then going to turn the autoclave on. Set the temperature for the packs to be autoclaved. We will turn the function dial at the bottom to fill. You can watch the water at the bottom of the basin fill to the fill line. Once the water reaches the fill line, you turn that function knob to sterilize, or STE. You can add your tray to the rack inside the autoclave, or add your packs to the tray first. Ensuring that the packs do not touch the back or the top of the chamber, as they can burn your packs. I've stopped the video here as Peggy adds both packs and pouches into the autoclave. This is less than ideal for today's current practices. We would then take the autoclave door and close it over. Using the locking mechanism of the handle, the knob will spin until tight. Once your autoclave door is closed and secure tight, you can then turn the temperature and pressure dials to the appropriately set amount of time and temperature. When the autoclave has finished its cycle, it will likely ding. Once the pressure is released from the autoclave automatically, it is then safe to open up the door. The Animal Health Center has recently purchased a new automatic autoclave. It is digital, but a little bit more tricky to operate.
Hi everyone, we're going to talk about the automatic autoclave now. So when you first come in, you need to plug in your automatic autoclave and then turn it on. The switch is right on the side. It takes a little bit of time to warm up. One thing to mention is that the door to the automatic autoclave will not open unless it says on this screen, system ready. So if it is unplugged, turned off, or in the middle of a cycle, it will not open. So I'm not going to close it right now because it won't be able to open back up, but to open it, you pull it towards you. So you put your hands in here, push a little bit with your thumb and that'll unlatch it. So again, it needs to say system ready to be able to open the door. So if you're confused why your door won't open, it's because this does not say system ready. It has an electronic lock. When you are loading your automatic autoclave, there is a lovely grate inside that can be used for your blue V-reel packs. So these V-reel packs can go in on their side, like you see. It allows them to be spaced out. Make sure the paper is all in one direction, the plastic in the opposite, because you don't want to load them like so. You don't want plastic to plastic or paper to paper. They need to be alternating. Okay, so you can load view reels if that's what you're running. If you're not running view reels and you want to run a full plaque, you can take the grate out and you can put your surgical pack in like you normally would with any other autoclave. So before you start, you want to make sure that your reservoir is full. The reservoir is on the top of the autoclave, just as it is in all of your other autoclaves. You're then going to look at your screen. So this screen, we're going to zoom in a little bit here. So now we're going to select our cycle. We are going to be using, with the exception of when we're doing something that is not normal, you guys are always going to use wrapped instruments or pouches. All of our instruments are going to be either wrapped or in a view reel pouch. So this is the cycle you want. And then you press start. Now, if the door is not closed properly, you press start and it'll come up with an error. And this error will say the system is not ready to run cycle. The door is open. If this happens, press stop, close your door properly, and then press the start. If at the end of the cycle, your instruments are not dry, you can run an extra dry cycle. So use your up and down arrow keys to find your extra dry cycle. And there you go. So once you find that, you make sure your door is closed and you press the start key. When you are finished your autoclave, first thing you're going to do is turn it off. Once it has been turned off, then you unplug. That's it.
It is very important to always handle your sterilized packs with care. Once the sterilization procedure has occurred and your packs are deemed sterile, it's important to put these dry packs away. Putting them into designated surgical pack cupboards is ideal as it keeps the dust, dirt, and debris away from them. We always want to make sure when we are placing down surgical packs on surfaces that there's no water on the surface. You will immediately contaminate your surgery packs should you place it in water, as the water will bleed through to the instruments. If you feel your surgery pack has been compromised in any way, it is important to re-sterilize your instruments. Failure to re-sterilize your possibly contaminated surgery pack could result in patient compromise or post-surgical infections. There are recommended storage times for sterilized packs. Double wrap packs have a shelf life of 4 weeks. Double wrapped 2-layer or double thickness, heat sealed in a dust cover after sterilization, has a 6-month shelf life. Double wrapped 2-layer or double thickness, tape sealed in a dust cover is 2 months. Double wrapped non-woven barrier or paper is 6 months. Paper plastic peel pouches that are heat sealed have a 1-year shelf life, and plastic peel pouches that are heat sealed have a 1-year shelf life. When wrapping your packs to be autoclaved or sterilized, it's important to always label it appropriately. You can write on the tape section of the pack, indicating to whom wrapped it, the contents of the pack, and the date it was sterilized. Some clinics have multiple methods of sterilizing and will put of which sterilizer was used. The next method of sterilization we will discuss is ethylene oxide, or EO2. EO2 is flammable and explosive. It is a gas when at a temperature above 10 degrees Celsius. This sterilization method can kill microorganisms like bacteria, spores, and fungi, just like autoclaving. This sterilization method has criteria that have to be met prior to sterilizing. No equipment to be sterilized can be wet with water, as ethylene oxide cannot penetrate water. Endoscopes or fragile material that cannot withstand heat and temperature are often sterilized using this method. There are environmental and safety hazards using ethylene oxide for sterilization. There is a unit that can be purchased so that venting of the ethylene oxide is appropriate after sterilization has been determined for your packs. Exposure times can vary. Some packs take as little as 48 minutes, and some packs or tubing can take several hours to sterilize. The gas diffuses through the instrument packs, killing organisms it contacts. An aeration period must occur to ensure that this ethylene oxide has been diffused from the packs. Care must be taken when using ethylene oxide sterilizers, as ethylene oxide is flammable and very irritating to your respiratory system if inhaled. Storage of sterilized packs can last 1 year. Other methods of sterilizing include ionizing radiation or plasma sterilization. Plasma sterilization uses hydrogen peroxide gas to produce free radicals to kill microorganisms. This occurs within a closed chamber. This method is rapidly replacing ethylene oxide sterilization as it has less environmental significance. Ionizing radiation is often used to sterilize surgical supplies or catheters or indwelling or implants for surgical use. Cold chemical sterilization. Glutaraldehyde solution 3% is a solution that sterilizes inanimate objects on contact. It's non-corrosive. It can be used for delicate or lensed instruments. It's important to clean and dry instruments prior to using them on your patients, and also to remove all organic materials prior to submerging them into a cold chemical sterilization tray. Cold sterilization systems are often used with instruments that cannot be autoclaved or gas sterilized. You can submerge endoscopes and arthroscopes in the glutaraldehyde, and it is safe for these tools. Most clinics will have a cold sterilization tray similar to the one imaged here. Immersion times are suggested 10 hours for sterilization and 10 minutes for disinfection. When preparing packs for sterilization, it's important to always add indicators to your packs. Indicators are specific tools to help us identify sterilized packs. Steam sterilization methods use tape or steam indicator strips. Once the steam, temperature, and pressure has penetrated the strip, the indicator will turn from blue to black. On steam sterilization tape, or autoclave tape most commonly called, the tape is usually tan in color and it has strips impregnated in this tan tape that turn from white to black once exposed to steam and heat. This black hashtag appearance on your tape is a universal indicator that the pack went through a sterilization process. There are indicators for ethylene oxide sterilization as well. It is tape specific to ethylene oxide. The tape is usually green and impregnated with a material that turns red when exposed to ethylene oxide. Stickers can also be used on some packs or on the inside of some packs to guarantee sterility. These stickers can come in a variety of colors. Some are purple when not exposed to ethylene oxide and then turn green when they are exposed. Others are white and then turn blue once exposed to ethylene oxide. It is important to become familiar with whichever product you're using in clinic, as it becomes second nature when pulling packs for surgery to look at these indicators to ensure that they're sterile prior to the commencement of surgery. There are different materials used for wrapping and pack prep. Textiles are often used in all clinics. These are single or double thickness layers of material or cloth. You can use nylon film or pouches, paper indicated for use in autoclaves or gas sterilization machines. There's impervious or water repellent drape material. Hand towels or huck towels are often used to wrap small packs or packs that are leaving the clinic for ambulatory basis. Metal trays are often used with or without a lid. These are mostly used for flash sterilization. Most clinics have a standard operating procedure of how instruments and packs are wrapped. Single-use instruments or instruments that are not often used are often wrapped separately from a pack. If additional instruments are required for surgery, it's often at the request of the surgeon. Pouches. Pouches can come in different forms. You can have paper pouches, heat-resistant film pouches, or a combination of paper and film pouches. These pouches can be used to sterilize individual amounts of gauze squares, bandage material, or instruments that require separate sterilization. These pouches often have indicators right in them. The back side or the rear side of the pouch of a paper, film, combination pouch will often have a circle or a square that's colored to indicate whether a sterilization process has occurred.
Let me introduce you to the Millpack Cell Seal Sterilisation Pouch, designed and manufactured by Millpledge Veterinary. There are currently several ways to package items that need to be sterilised. You can have nylon film. This is available in a roll and in a variety of widths and can be cut to length. However, due to having two cut ends, both ends must be taped closed. The tape generally used for this is Bowie Dick tape, which is of a beige colour and impregnated with a chemical strip that turns brown when it reaches a certain temperature of 249 degrees Fahrenheit. The colour change on the tape doesn't guarantee effective sterilisation. To ensure sterility, the temperature has to be maintained for the acquired amount of time, and the Bowie Dick tape will only change on temperature, not time. You can of course add a TST strip, however this will cost more time and money. Then we have textiles. These are certain cotton textiles such as drapes and towels that can be used to wrap instruments. Whilst they are reusable, the disadvantage is that they have to be washed and dried, and this will cost you time and money. Also, they're not waterproof, therefore the package can easily be contaminated by a liquid substance. Then we have the self-seal sterilisation pouches, or autoclave bags as they're sometimes known. These are peelable pouches with a paper backing and a transparent film on the front. Let me now show you the Meal Pack self-seal pouch from Meal Pledge. The Meal Pack is a bespoke design specifically for veterinary use. The number one priority when selecting packaging material for medical devices is the ability for the package to maintain sterility from the point of sterilisation until open for use. The Meal Pack has a high medical grade paper back. This grade of paper provides excellent microbial barrier properties. Due to the backing paper's strength and durability, it protects the package integrity from product breakthrough from the inside and is more resistant on the outside to handling and storage. The backing paper incorporates two indicator spots. One is sensitive to change when used in a steam autoclave and changes from blue to brown. The other is sensitive to ethylene oxide, and this will change from pink to orange. Meal packs can be sterilised in an autoclave on either a 249 Fahrenheit cycle for 15 minutes or a 273 degree Fahrenheit cycle for 3.5 minutes. This will ensure your sterility for the correct time and temperature. The labelling area is unique to Meal Pack. It enables you to clearly write the contents of the package, the date the package was sterilised, the name of the person who packaged the equipment. You can even put a use-by date on. On the other side of the label, there is a self-adhesive strip. This will allow you to easily secure your self-seal pouch. There is an integrated sterility test strip. This gives you the same sterilisation indications as the dots on the back of the paper. This needs to be detached and placed inside the pouch. All you have to do is fold along the perforated dotted line of the STS strip and press firmly to create a crease. Then fold again along the seal tab dotted line and press to create another crease. You can now easily remove the STS strip and place inside the pouch. Having a sterility test strip included with every bag will save you time and money, which enables you to be confident in the sterility of your packs and that you are working towards the best practice standards. The blue tinted transparent film is of high quality and strength, which actually lowers the risk of punctures and tears. However, as it is a blue tinted transparent film, it provides easy viewing of instruments and helps identify any punctures or tears of the film that may occur. The Meal Pack features a triple edge seal. This secures the edges from separation or tearing by instruments. There is a fourth reinforcement seal at the peel end of the pouch for even greater protection. This helps prevent the pouch from splitting open when used with heavier equipment. They also have heat sealed upper corners. These help prevent dust from collecting at the opening seal, which reduces the risk of contamination. Whilst the design of the seal is reinforced, the pouch is easy to peel and separate when opening. This is made even easier as there is an integrated peel thumb notch for easy handling. Milk Pack is available in 5 sizes of width and length to cater for the vast array of equipment. These are 3.5 by 9 inches, 5.25 by 10 inches, we have a 5.25 by 14 inches, then a 7.5 by 13 inches, with the largest at 12 inches by 15 inches. These are all available in boxes of 200. Let's look at the process of how to use a Milk Pack and demonstrate how quick, easy and convenient they are to use. We're going to sterilise a wraps bandage for an orthopaedic procedure. First, choose the size of pouch that most suits your need. Write all required details on the contents label. Fold along the perforated dotted line of the STS strip. Then fold again along the seal tab dotted line. Now press firmly to create a good crease. And you can now easily remove the STS strip and pop it into the pouch with the wraps bandage. Peel off the adhesive backing paper from the seal tab. Fold the seal tab over onto the film and firmly push all the way along the seal tab to secure a tight seal. There are many benefits to using the Milk Pack self-seal pouch. The medical high-grade paper that gives you great microbial barrier properties. Extremely strong blue transparent film which lowers the risk of punctures and tears. It maintains flexibility even after the sterilisation process, so it will not go brittle and tear open. Secure reinforced seal edges to prevent pouches from splitting with heavier instruments. An integrated STS strip that saves you time and money. So there you have it, Milk Pack, the ultimate all-in-one sterilisation pouch.
Biologic testing. Because autoclaves and ethylene oxide sterilizers should be monitored for efficiency and effectiveness of their sterilization practice, it is important to introduce biological testing to your standard operating procedures. Sterilization eliminates the hardiest of microorganisms. This absence will ensure that your patient is safe when in contact with any instruments for surgery. To perform a biological test, commercially available products are available to put into your sterilization machines. A cycle of sterilization is ran, and then these vials are cultured to see if the effectiveness of your sterilizers is suffice. Bacterial spores and microorganisms within these vials should be killed by this sterilization process. If they are not killed by this sterilization process, then your autoclave or ethylene oxide sterilizer is running subpar. Another test to verify sterility is surface sampling on your instruments. You can use a sterile swab and swab the surfaces of sterilized instruments and then send it to the lab for culture. Individual SOPs or standard operating practices for our Seneca's Animal Health Center will be posted on Blackboard under this week's lecture material. We have SOPs for the use of the ultrasonic instrument cleaner, operating the manual autoclave, operating the automatic autoclave, and super germaphene for instruments and endotracheal tube sanitization. We will briefly discuss surgical needles and suture material. Surgical needles are the needles used to deliver the suture material through the skin in the attempts to seal a surgical incision. Once stitches are in place, the body's naturally healing ability will take over to heal the wound created. Types of suture material. There are many types of suture material used in veterinary medicine. There are absorbable suture materials and non-absorbable suture materials. Absorbable suture materials lose their tensile strength within 60 days after placement. The body must absorb this suture material as it is left behind after surgery. Non-absorbable suture materials. Often these are used for the skin incision, and these can be removed with a pair of suture scissors. The body does not absorb non-absorbable suture material. Suture materials come in a variety of sizes, 3 being the biggest diameter size suture material, and 3-0, pronounced 3-0, is one of the smallest suture material. These are the most common used sizes in veterinary practice. Sometimes during or after a surgical procedure, tissue adhesives or superglue, tissue glue, is often used in between the stitches to ensure the integrity of the incision. Often tissue glue is used for small lacerations. It is an adhesive that is okay against the skin. Some clinics use metal staples or skin staples to attach the edges of the skin together. This is not a common practice in small animal medicine, but is often used in large animal practice. Surgical needles or suture needles. These needles are available in a wide variety of shapes and sizes. The type of suture needle used depends on the characteristics of the tissues needed to be sutured. There are taper point, taper cut, regular cutting, reverse cutting, spatula, and blunt point surgical needles. Oftentimes, the size of your needle is about the size of your suture material used. If you can imagine having a larger needle going through the skin with a small amount of suture or small gauge suture material, this will leave a gaping hole and the sutures will be loose. Usually, surgical needles are the equivalent size to your suture material. The surgical needle selection is usually at the preference of the veterinarian performing the surgery. Some needles are meant to go through fibrous tissues, and some needles are meant to go through delicate tissues. If you're employed by a veterinary hospital or practice, as a veterinary assistant, it may be one of your jobs to remove sutures in those patients that return postoperatively. It is important to understand how suture material is laced through the skin. We will have an opportunity in lab to look at the different suture patterns and engage in suture removal on a model animal.
Next we're going to demonstrate the removal of sutures. So again, we start by applying our personal protective equipment. Basically we'll be wearing our lab coats and scrubs. You want to have your assistant restrain the animal for the examination and removal of these sutures to prevent injury to both you and the animal while you're performing the procedure. Depending on the location of the sutures, the restraint technique will be varied, but should be consistent with the mobilization of the area of the body where the suture line is. The suture site is examined, and if there are signs of infections are noted, then a veterinarian should be summoned to examine the animal. If no issues are noted, then you may proceed to remove the sutures. The suture scissors is used to cut one side of the suture, and a thumb forceps is used to pull the suture material from the skin. After all sutures are removed, allow the animal to stand and visibly inspect once again to make sure the incision line is held together, and always make sure to praise the animal for his cooperation during the procedure. So we have Holly holding the dog, and he's doing really well. And to do this, I always look at the suture line, make sure that everything looks like it's healed. I use a thumb forceps, and this is a special stitch removing scissors. And what I do is I just grab the one end of the suture material, pull that over to the side, slide that little hook of the suture removing scissor under it, cut one edge and pull it out. And repeat that for each suture until they've been all removed. So after all the stitches have been removed, make sure you check the suture line, make sure that it's still holding together, and then the animal's ready to go.
There are common suture patterns used across the medical profession as well as the veterinary profession. Focus on identifying two suture patterns, the simple interrupted and the simple continuous. There's also a vertical mattress, horizontal mattress, cruciate suture, the Ford interlocking, cutaneous subcuticular, and the continuous horizontal mattress.
In this video, we will demonstrate a single interrupted stitch with an instrument tie. To perform a simple interrupted stitch, cock your wrist back and position the needle perpendicular to the skin. Drive the needle into the skin and turn your wrist and let the curve of the needle do the work. Depending on the width of the bite and the length of your needle, you can either take it in one bite, like so, or two. If you take it in two, reinsert the needle directly opposite where the needle is exiting at the same plane or depth. If you fail to do this, the skin edges will not align properly. Turn your wrist and drive the needle out the skin. It should be at the same distance from the skin edge as the site of entrance on the other side. To perform an instrument tie, pull the suture through until there is only a short stub of suture left. It should not be too short that it will pull through with a small yank, but not too long or else it will be cumbersome to work with. Wrap the suture around the needle driver toward the opposite side and grasp the free end of the suture with your needle driver. Pull the needle driver and suture back in the opposite direction toward yourself. To perform the equivalent of a surgeon's knot, wrap the suture around your needle driver twice before grabbing the suture. This will ensure that the first throw is tight and will not loosen when you release the tension on the suture to perform the second throw. To perform the second throw, wrap the suture around your needle driver toward the free end again. Grasp the suture with your needle driver and pull it in the opposite direction. As you tighten the throw, you should note that the knots you are creating are lying flat, and thus your knots will be square. Repeat several throws in alternating directions, and then cut your suture. To perform a simple continuous running or baseball stitch, start at the apex of the incision. Anchor your suture by taking the first bite across the wound edges as you would a single interrupted stitch. Bring the edges together by tying the suture using a hand or instrument tie. Cut the free end of the suture short. Load your needle and drive the needle horizontally across the wound, taking care to maintain the same distance from the wound edge on each side and also the same depth on each side. Taking bites at different depths will cause the closure to be uneven, with one side of the wound higher than the other. You should be able to drive the needle across in one bite. First, cock your wrist back so that the needle is perpendicular to the surface of the skin. As the needle penetrates the skin, turn your wrist and let the curve of the needle do the work. Direct the tip of the needle to where you would like it to exit on the opposite side. Grasp the needle with the forceps and reload the needle on your needle driver so it is ready for the next bite. You may use the forceps in your non-dominant hand to help direct the course of the needle by grabbing and stabilizing the skin edge or by placing counter pressure on the skin. Some attendings may discourage you from grabbing the needle with your forceps. If this is the case, use your forceps to grab the skin edge near where the needle is exiting. This will stabilize the needle. Advance the needle through until 2/3 of it is through the skin. Then, with your needle driver in the pronated position, grab the needle directly at the skin level, ideally at an angle so as to optimally load it for the next bite. Rotate the needle driver in your hand and take the next bite. Continue to close the wound in this fashion. When you arrive at the opposite end of the wound, tie the suture strands together using either a hand or instrument tie. Then, cut your suture.
This concludes Week 3's lecture. Please ensure that you mark in your calendar the assignment due date. Always reach out with any questions or concerns. I'm always happy to help. I hope you enjoyed lecture this week. We'll see you in lab.